Good morning, everybody. Welcome. We're letting people trickle in. So, good morning and welcome to our spring graduate colloquium where Aspen and USU students have the opportunity to showcase their hard work to our community and let us support the next generation of graduate scholars. Today is the final day of the colloquium, and we start with Dr. Lori Lucas presenting on her project related to uncivil encounters in nursing education, a qualitative descriptive inquiry into student and faculty perspectives. Welcome, Dr. Lucas.
Thank you. Thank you so much for creating a platform for us to revisit our my research. I'm so grateful to be here. It's been on my calendar. I've looked forward to it because what happened to me, I think I learned in one of my classes at Aspen, after the dissertation, I went into a slump, like a creative slump, because so much work went into, you know, the manuscript and then I was just done. And so I'm so grateful to be back and to revisit my research. And I found that it's in revisiting her that it's like seeing a combat buddy, somebody that you went into combat with, and you're glad to see each other, but you went through some stuff. And so that's what I felt when I went back through my research and looking through my manuscript. But I'm very thankful. Um, are there any doctoral candidates or students online right now? If you want to react and let us know that you're here, I was curious. Um, I have some insights. I'm going to share anyway. I'm in looking back, and it's not like that, you know, um, blind eye looking back. I have some insights from my research, and then going through the process of writing a manuscript, and then defending the dissertation. One of the main insights that I have is that my college thoroughly prepared me to do research. I graduated with the skills to do research, and I want you to know that I will do it again. Um, I'm very proud of the work that I've done. One of the things that helped me the most, and I hope that all colleges do this, I think it may be unique to Aspen, but their template that they use to help guide um, candidates through the process really, really helped me. Once I mastered that, I found that I was able to go on. And there was a point when I didn't think I could, and the template really helped me. And so, Dr. Ballard, if you're on, I don't know if you're on or not, but I want to thank you and your program and the Department of Education at Aspen for thoroughly preparing me. So that was one insight that I have. I want you to know that when I do further research, I will use your template. And I hope that I can still reach out to some of you for help. So that was one insight. Another insight that I have is that you cannot do this alone. If you're a student, you can't do it alone. So I had to have a mentor, and I was so grateful that I work with the mentor, and it's Dr. Lisa Moore. I hope she's on. She was invaluable because she told me the truth, and I really, really appreciate that. So that's another insight. Let's see the last insight that I have is that I thoroughly proved a theory. And that is the 80/20 rule. Have you heard of the 80/20 rule? Because I tell you, I was underwater. The last semester, I was underwater 80% of the time because I'm a novice. This is new information for me, learning how to do research. And so some things that really helped were my committee. I had the best committee. The committee chair was chosen just for me. Dr. Dunn, if he's on or if somebody needs to tell him, he was such a steady leader for me. One time I was so freaked out by the immensity of this project. I didn't think I could go on. And he basically said, Lori, snap out of it. You're telling a story. You love your information. Just tell a story. And so that very day, I bought a whiteboard and I wrote out the storyboard. And then that's when things really clicked for me. The IRB process and going through that was it. eye-opening, and the city courses that Aspen requires really, really helped me. Other members of my committee, your committee is really important. I had an expert writer from Aspen, Dr. Beeman. She's an expert in writing. She actually teaches that class. And then lastly, I had a colleague that was on my committee who told me the truth. She always told me the truth. When I was going back and forth with the template, um, she would put in the comments sometimes, like, "What did you mean here?" And I remember writing back going, "I really don't know what I meant. I was just trying to fulfill the assignment." So anyway, so it's good to have all those people on your team. And I'm more than fortunate for where I went to school, for the people who supported me. And I cannot wait to show you the insights that I have from from the research. Excuse me just a minute. There we go. So a little bit about me. My background in nursing is I was an ED trauma nurse for a long time, and we never really quit jobs. We just kind of go into another job. So I found hospice through a friend, and so I did ED trauma and hospice. And lastly, the last little bit of my career, I've been in higher education, and I really, really loved all of those jobs, and they built into me who I am. My degree from Aspen is in education, but it's also has a specialization in organizational psychology. I believe that we all deserve a really great place to work. And that's how I sort of started focusing on incivility because it's just a few people and just a few acts that really make you want to leave your job. And research shows that you make the decision to leave long before you tell anybody. And after that, it's too long. So that's why my heart is for organizational psychology. And then you'll hear in just a minute about recent events that have really motivated me more than ever to rescue the heart of nursing. So, my research is really important to me. It's changed me, and I hope to make an impact. So, life after the dissertation, I want you, if any students are on, I want you to know that there is life after that. So, I picked up my habits of creative writing. I really love to write, and so I love to tell stories. I started sewing with my granddaughter and teaching her, and that's been fun. I'm an avid reader. If you call out audible reading, which I do, I have a long commute, so I read a lot of books. And because of my hospice background, I'm fascinated with near-death experiences. There's a whole repository of people's stories, and I love those. I'm addicted. And my new obsession, and I want you all to be obsessed as well. Many of you probably know this, but it's called spellers. Have you heard of that? Um, it's a whole population of people that I didn't know about, and they're non-speaking or minimally speaking autistic individuals who communicate with the help of a spelling board. I've in the chat you'll see there's a YouTube, there's book recommendations and podcast. If you want to be encouraged, I've found that in the last 3 days, as I've pondered it, it's made me so hopeful for humanity. Lastly, I love pets and I'm nothing without my family and friends. So that's a little bit about me. All right. So the objectives for today are simple. I'm going to set the stage by telling a personal story. And this personal story made me look through my research in a new lens. And then I'll do a little bit of reviewing my research and what I found. And then lastly, this is where I'm going to count on you. Now that I've gone back, I've done the research and I've gone back through it, I want a charge to make the best use of my research. So I would love somebody to write down um, when it's time for question and answers, ask me about publishing because I have some questions about that and I need your help. So that's where we're going today. Okay, how about that for a grabber? Call 911. The heart of nursing is in trouble. And I can say that. I feel like I can say that because I am a nurse. And so let me tell you a little bit about the story that made me write that headline. And it's Sandra's story. So Sandra's a good friend of mine. And a couple weeks ago, we were going to a concert. And as we were walking up to the venue on a major university in the Austin area, she collapsed. She had to sit down. And so we found a ledge. And very soon she said, "I've got to lay down." And so she laid down. The paramedics from the venue came and assessed her, and her blood pressure was 80 over 40. And for those of you that are not nurses, that is very, very low. And the paramedics came and they looked at her and they said, "Are you dehydrated?" And it wasn't long before it was very hard for her to answer questions. They said, "We would like to take you in a wheelchair to go assess you." And Sandra said, I cannot sit up." And I know that with the blood pressure, she would have probably passed out. She said, I feel compelled to lay down." She was profusely sweating. Um, I talked to her, asked her, I said, "Sandy, what do you want to do?" And she said, I need a stretcher." And I said, I asked the paramedics, "Do you have a stretcher?" And they said, "No, just a wheelchair." And I said, "Sandy, what do you want to do?" And she says, "Call 911. I need an ambulance." And so as her representative, I turned to the paramedic and I said, she's requesting an ambulance. And that was the very minute a huge power differential was noted. For whatever reason, that was very offensive to them because they had a protocol, and an argument ensued. They did not want to call an ambulance. And I said, "It is the patient's right. Call an ambulance." It took forever. They took her blood pressure again. I'm guessing that it's about 30 minutes in after we requested an ambulance. Her blood pressure was now 70 over 40. As her advocate and friend, I said, is this the process? Or are we just going to let her die here? Is that because we're following your processes?" And it made them mad. So set that story aside. And now I did research yesterday because ambulances and EMS, they have to publish their call to door time. And for the month of April and for the last quarter, their call to door time was 37 minutes. Sandra laid on that sidewalk or on that thing for 2 hours. And it was they were proving a point to us. And they ended up getting her to the hospital. She got good nursing care. She had a doctor who nailed the problem. They found her source of infection. She was septic. She was dying. In the ambulance, I haven't got to follow up with her about this, but she said she did feel like she was dying while she was in the ambulance. And so we get her to the hospital. She gets good care. While they're, getting her into the hospital, I had to sit out in triage or out in the waiting room. It's a major metropolitan hospital. It has plexiglass. The nurses are behind glass, bulletproof glass. There's policemen there. And the demographics is just what you would think in a major metropolitan hospital. The triage nurse, the person who does the intake, is on a speaker, and everybody can hear what you're coming in for. And so this elderly gentleman walks through, and the triage nurse says, "How can I help you?" And he goes, I'm so sorry, I'm really dizzy." And she goes, "Dizzy? You don't really look dizzy. You're standing." And my heart just sunk. The next patient comes, and they did their thing with him, ignored him basically. At that point, when his shoulders went down, I knew that he was now he has to prove his value as a human being, and then he's allowed to be here. The power differential. Another patient came in, a college student who came there, and I could hear everything. Why are you here?" And then the nurse asked, "Why are you here?" And she goes, "Well, I have had an earache. I have an earache." And she goes, "How long has this been going on?" And she said, "I think it's day 3 now." And she goes, "Oh, and so now it's an emergency." The triage nurse said that. I wanted to intervene, but I knew that if I said anything, I would be, first of all, escorted out of the hospital. And then I wouldn't know what would happen to my friend who was already, in trouble as well. And so that's the reason for this headline: "The heart of nursing is in trouble." I will briefly mention the recent social media lunacy that's taken place. A CRNA, a nurse who specializes in giving anesthesia, put up on their social media that if a person from a different political background comes into their care, that they will deliver the paralytic for surgery, but they will not deliver the anesthesia or the pain medication. I, I don't know what to say. Another nurse on social media, a labor and delivery nurse, picked somebody from her opposing political party and said, she said the most deplorable things. Basically, "I hope you tear and that you're never the same." And so this is the reason for this headline, "The Heart of Nursing." I think incivility now is on a fast track, and I'm hoping and with your help that I have the courage to do something about it. So the background of my research is focused primarily on, well, actually exclusively on nursing education. Nursing education milieu, it is very competitive. It's hard to get into nursing school. And once you're there, it's hard to stay because it's a high stakes environment. We primarily use high stakes testing. In other words, you only have 4 or 5 opportunities to prove that you're as a student that you're allowed to be there. And so it's a fertile ground for incivility. The research, my research focused primarily on student and faculty perspectives. How do they perceive incivility? What is it, and how does it impact their learning? When you're doing research, you have to, once you go plow through the literature, you have to come up with a problem statement. Why am I doing this research in the first place? And so my problem statement was it's not known why incivility in nursing education remains a growing phenomenon. The literature really doesn't know why it's growing. A few things came out of the literature search is there's this pervasive feeling of student entitlement. And now that I don't know if it's true for universities, but community colleges are funded now on outcomes. And so we need students to pass. We need them to progress and pass. And so students have a certain amount of entitlement, and administration in schools and oversight is really putting pressure on faculty to make sure that everybody passes. It's a disservice, I believe. Then there's emotionally depleted faculty, and then stress and emotional distress on both parts. And we'll find that I was so fortunate to find a theory that supports what we're talking about. So how did I find information on this? So I found that the holistic strategy was the best, and I'm so fortunate that I work at a really great community college that has a wonderful library. And I was going to school at Aspen University. Their library is phenomenal. So I had access to the best literature. So I was able to find relevant data that really supported what I was doing. I found some really great seminal works. Carter in 1989 wrote a book, an old-fashioned book about incivility. And in that book, I would recommend everybody get it because it talks about it's okay to disagree. It's okay to disagree, but we need to remain respectful. And I feel like in our society today, that's lost and lost art. So that book really helped. And then Clark, she's the premier, Dr. Clark is the premier nurse educator on incivility. So I found a lot of her works. And Luparel was another one. Her work was outside of my ability to use in my manuscript, but it did help with the platform. And then lastly, the theoretical foundation, Hobfoll's conservation of resources, and I think it's helpful for all of us, so I can't wait to talk about it. Okay. Along with it, once you find the problem statement and everything has to go together, I came up with research questions. I had one major research question with some sub questions. So my major question was, how do nursing students and faculty perceive and experience incivility in nursing education, and what behaviors contribute to this? And then the sub-questions helped me tease that out just a little bit. How does it impact the environment? And how do students and faculty really define incivility? So I have to take a pause here and a little bit of a leap because I think it'll help support the rest of the discussion. But I want to talk about the theoretical framework, Hobfoll's conservation of resources. Basically, he says that as human beings, we are always trying to manage these 3 domains of resources: our physical, environmental, and emotional. And so for the physical, it's like, really, are we eating right? Are we taking care of ourselves? And if we're doing that, we have some vitality. If not, we move towards fatigue. And what that looks like for me, I should not be surprised when for breakfast, I have a Diet Coke and a Twizzler, and that by lunchtime, in my mind, I've already changed careers 3 times. It's because I've not been taking care of myself. So we have to take care of ourselves so that we can kind of stay vital. The same for environmental. And this, to me, really highlights the work environment. If we have a good work environment and we feel supported, we can truck right along. But in nursing education, I feel, and in higher education, I feel that the regulatory environment constantly derails things that we want to do. It's become oppressive, not supportive, and we lead toward disruption. At least that's my personal experience. And then another bucket is emotional. Like if you have a good family life, if you're supported at home and you have good work colleagues, we have resilience. And in nursing, that we don't have that anymore. The workplace and the environment has become hostile. So many are leaving the nursing profession because we're experiencing burnout. So that's the theoretical framework. So think about that in your own life. Like how do those things play out for you? And I would ask you the questions, are you taking care of yourself physically? What's your work environment like? Do you love what you do? And then emotionally, how resilient are you? I found that after the pandemic, my resilience was very, very low. Okay, so the population that I focused on was associate degree nursing. It's a short, compact, very high stress 2 years for students. I chose students in their last semester, and then nursing faculty who have taught at least 1 year. We threw it out to a bunch of, as many as we could, 60, and we chose one of the three campuses to eliminate bias. I work for the college, so I needed a campus where I didn't work, and one of my committee members too. So we chose the campus where neither one of our were associated with, excuse me. I ended up with 11 nursing faculty and 9 nursing students. The instruments that I used was a survey, Dr. Clark's survey it's specifically designed for nursing education, and it measured everything that I wanted. My mentor, Dr. Moore, told me very early on, she said, you need to find an instrument that is valid and reliable and will support your research. And she was exactly right. And I found it. I was so lucky. My committee encouraged me to reach out to Dr. Clark and ask her to waive the fee, and she did. Anyway, had such a great team. And how I collected the data, I used SurveyMonkey because it was primary surveys. That's what I used. The only thing that I used is a secure platform. They really are the experts when it comes to surveys. And I found that the data extraction and their tools were very helpful. Then at the college, we had the privilege of using their learning management system. I used a proxy. Dr. Moore was my proxy. And so she put out the live link in the learning management system. She did reminders. I recommend anybody in life to use a proxy for a lot of things. I wish I still had her as a proxy for many things. It was a phenomenal decision, and it was the right thing to do because I do think I was able to kind of not be known. And so I think it helped the data. And then again, using the validated and reliable survey from Dr. Clark. Great. And so my method, I used a qualitative study because it's lived experiences, and I really did want to know, like, what do people really think? What do nurses, students, and faculty really think? And I love that it was a descriptive design because we really did just get descriptors. There were comments that given that really did influence the study, but for most part, it was really descriptive. And then I used the reliable and validated survey, and then my population again was nursing students and faculty. And at Aspen University, they require that we go through the city courses that talk about the ethical considerations in research. I found it so helpful. It helped me to always keep the participant in the center of what I was doing. Were they informed? Did they have informed consent of the study? Was there anonymity? Did I hold their data very secure and protect it? And then the last part, which was really hard, was the systematic review. Did I handle the data correctly? And I can confidently say I really did. I feel like I had the great support and I did a good job with that data. The day that the data hit, that I was able to open the SurveyMonkey and see the data that came from a study that I initiated, I was so thrilled. And I went over it with a fine-tooth comb, and I followed Braun and Clark's. This isn't Dr. Clark's, this is another Clark's thematic analysis. So I became familiar with the data. I would let it rest. And then I would go through it again and I would start generating codes. And then I would research it again and look for themes and review the themes and then define the themes. all with the help of spreadsheets that Aspen provided. And anyway, so they're so good. Okay, so all of that work, y'all look, and it's one little demographic on my presentation today, but there's a lot of information here. I was able to find categories, and the three major categories that I found from our research were there were behaviors, uncivil behaviors, there was the impact from those said behaviors, and then there were the perceptions. How do faculty and students perceive that? And so I got really good information. There were several overlaying themes. The participants talked about a perceived power imbalance, both the students and the faculty. The students said that they felt like the faculty had a lot of power because there were times in clinicals that they felt like they were looking down on the student. There was inconsistent grading, dismissive responses. From the faculty perspective, they felt like students were very challenging. They argued about grades. They showed lack of professionalism in the classroom. There was a lot of the impact is frustration. Both groups said they were very, very frustrated when these things happened. And then another perception was respect. Respect came up a lot, along with a lot of great positive comments that didn't make it. It just didn't fit the study. So, but anyway, that's the little graphic that shows all of that work. So putting it all together, it's the little things that matter. The eye rolls, sharp answers, harumphing, and side conversations. Those were the major things that people talked about. And I am an expert eye roller. The eye roll emoji is my favorite one. I've probably sent it to many of you. I have no idea until I reflected on this what that actually says. It's not like anybody can't crack that code when you roll your eyes. They know that you're dismissing them. And so anyway, I was chided a little bit. I chided myself about that. And so think about you personally. What is your personality style? Like, do this? Do you roll eyes? When you're tired or sick, do you give sharp answers? Are you known to harumph when somebody says something that you disagree with? Another thing that I'm guilty of is side conversations. And I can say with 100% assurance that in our faculty meetings, there are a million side conversations. I think faculty are the worst offenders. And it's especially if I don't like the topic, I'm always whispering to my friend, or I have text buddies in meetings. I hope you do too. I hope I'm not the only one. I'll text people in meetings when I'm not wanting to pay attention. All right. Putting it all together, what I learned, students want behavior boundaries. They said it. They want behavior boundaries. And guess what? Faculty want behavior boundaries. Both of them agreed on that. I think that's really neat and really telling. In part because of Dr. Dunn's encouragement to tell a story, once I got the data, I made up this fictional nursing student from the data and a fictional professor. And so if this artificial student, this fictional student were able to post on their social media from the data that I got, this is what they would say. I'm proud to be part of the nursing program that truly challenges and supports us. Our professors are experienced and deeply invested in helping us succeed. The clinical experiences are hands-on and prepare us to take the next step with confidence. Like any program, there's room to grow. Some students have shared that small incivilities like dismissive communication, unaddressed disruptions in the classroom can affect how we learn. But the fact that we can talk openly about these things shows how much this program cares about creating a positive, inclusive learning environment. As students, we need to take accountability for our behavior. I wouldn't want to be anywhere else. This program is shaping me into the nurse that I've always wanted to become. And I got that information from the positive comments that were outliers in the study. Because there were so few participants, and it was a Likert scale, it appears like we only focused on incivilities, but there were plenty of comments that showed that overall, students really liked this program. So let's see what the fictional faculty member would say if she were allowed the opportunity to post in the faculty newsletter. From the data, This is what she says. As a professor in the nursing program, I've continued to be inspired by the dedication of our students. I truly believe that our graduates leave well prepared to meet the demands of today's healthcare environment with skill, compassion, and resilience. Our work environment is collaborative and encouraging, and it's a privilege to be a part of a team that really cares deeply about the student. Again, that said, there's room for growth. I believe one area that I believe deserves attention is classroom management. Side conversations during instruction can be disruptive, and students would benefit from clearer expectations. Providing them with tools to manage conflict and engage respectfully can strengthen our program and our learning environment. Administration can support faculty by reinforcing clear classroom behavior policies, offering training in conflict resolution strategies, and promoting a unified approach. Together, I believe this faculty member believes that we can continue to raise the bar for excellence in education. So that's a true story of what the data told. It gave some good indicators of what's going on, but for the most part, it was pretty positive. Excuse me. There we go. So, what would I study if I were to study in the future? How could I make this study better? And I may, um, we'll talk about it at the end, but I was afraid to modify the INE survey. I could have, but I was just afraid to mess with it. So I didn't, and I should have. I should have modified the open-ended questions. I would have gotten better data. And I would create questions about the continuum of incivility. Maybe a mixed methods I think would be really good for this. Alternative research designs, I think a case study approach would be really interesting. And then I wish we could do longitudinal. I don't know how. Not in a short program. Maybe it would have to be in a bachelor's program. But I wish we could do that. Okay, so my conclusion, and I've changed a major one. Because of this story that I told you at the beginning, that's why I've changed. But practical implications. Clear behavioral contracts. Both the students and the faculty believe that behavior contracts for the classroom and clinical would be very beneficial. So we need to work on that. Before I said faculty and student training, I no longer believe that. Um, I believe that it needs to be a formal course. And you know that all of you in higher education, you know the uphill battle that I'll have with that. But I believe it needs to be an 8-week course where tools are given and the hearts are developed to be resilient. I believe it needs to be a formal course. I'm working on that. If any of you have any ideas or you want to help in that endeavor, please reach out to me because I think we are losing the next generation of nurses by not doing a formal training on incivility, how to develop your heart to where you care about people. I think we could do that with personal stories. So I've changed that. I don't think it needs to be a training. I think it needs to be a course. I would like to put pressure on for policy development about behavioral contracts and about follow through and what we are and are. Let me just say this. I feel that because now we are based on outcomes or completion rates for funding, I'm seeing a shift in how much pressure we can put on students to raise the bar and how they act in professionalism. And I think it's going to be a growing problem. I also believe that wellness and support systems need to be in place on every college campus. Every faculty member needs a place to talk. And we all have our informal places to talk, but I think we need to have more access to qualified professionals when we're absolutely at wit's end. Okay. A couple post research findings that have changed how I think. The first one, I attended a conference with Dr. Tim Bristol. It was at the Association of Associate Degree Nursing Organization, sorry, for Associate Degree Nursing Conference. And he talked about the decline of resilience in nursing. And isn't that what Hobfoll was talking about? We have to have the emotional base to be resilient. He published a statistic that is astounding that within 3 years, 60% of new graduates leave nursing. how can we maintain the profession in that environment? How can we maintain? We can't. And so we have to intervene. A 911 needs to be called for to build nursing resilience. That's why I'm more empowered than ever to want to make a formal course in civility. And lastly, the college suffered a really harsh ramification of incivility and bullying. We had a graduate who graduated from our program in December, started her new job. Um, the preceptor, that's what they call people who train nurses, and the environment was hostile and she was bullied. And in March, she took her life. So that motivates that the impact of incivility cannot be overstated. A young person took their life because they were being bullied at work. And so I have to do something. I'm compelled to do something about this. And so this is where I need your help. Do you remember the question I asked somebody to write down? Would you mind asking me that? If you don't remember, it's okay. It was about what am I going to do with the research? And so it's about publishing. Um, my sister-in-law taught me how to sew, and she taught me how to make quilts. And I remember the day when I made my first quilt all by myself, and I was going to show it to her. I remember the trepidation that I had, the trepidation I had from I didn't want her to look at it too close because I thought, oh my gosh, she's an expert. And so, of course, she looked at it and said it was beautiful, and I did fine. I feel that way about my first research. Like I'm afraid to ask to publish this because I don't know if it's like the sample was so small and would it be relevant? And so for the experts online, what would you tell me? I'm sorry, I'm asking you the questions. Sorry about that. But what do you think about that? Okay, maybe it's not the right question to ask. Do you have any questions for me? Anybody online, you can ask me anything.
Dr. Lucas, it is wonderful to see your face again.
Hey, hi.
And you embody what any educator or academic profession would hope for students to go through the process that you went through with dissertation, to love what you did, live what you did, and continue to press it. So, in terms of publication, I was always supportive of you doing that. You still can do it. We have ProQuest available for dissertations.
Okay.
You can reach out to me,
Okay.
same email address or Dr. Ballard.
Okay.
But there are procedures we'll send you for how to log into ProQuest since we
Okay.
partner with them and we'll get you published. Remember that what you did may be small, but it's the generation of large.
Yeah.
Small is what gets it started, and large is what happens when more people get involved. So,
Okay.
and then there are, if you're going to do journals, not your dissertation, your ProQuest is pretty much the dissertation. But if you're going to do journals and stuff, there's all sorts of nursing journals out there that
Okay.
and once you get accepted by them, my understanding is that you can become a regular contributor.
Oh,
So
wow.
your thoughts and beliefs and desires, but it's truly great to see you again. I don't want
Same.
to take up all the time, but keep free. I tried to write you and tell you I was going to be on. So maybe you had an email address that no longer works for me. So,
Oh, okay.
and so keep in touch with me. I have the same
Okay.
email address for now. Thank
Okay. Thank you so much. I really appreciate that encouragement. And it's not really an ego thing, in case that's coming across about wanting to publish. I want to do it for the patient who was dizzy in triage, for the student who had an earache in triage, and for my friend Sandy. I don't want that to happen to anybody else. So, anyway, I appreciate that. Ask me anything. Is there anything else that you'd like to ask?
Dr. Lucas, hi, this is Dr. Oline.
Hey.
Um, I have not spoke this week because I'm
Yeah.
sick and I
Yes.
to strain my voice, but This is a topic that is near and dear to my heart. Excuse me, I did my master's thesis on lateral bullying in nursing, and
Wow.
um, I did a qualitative study where I interviewed nurses in my hometown, and
Mm,
the results showed that 100% of the nurses had either witnessed some type of bullying in nursing or been subjected to some type of
mm.
bullying in nursing. And I personally have left at least 3 nursing positions because of a toxic work environment.
Wow.
Being threatened to be clobbered was the word that they used in the parking lot after work myself.
My
And so
gosh.
it's very dear to my heart. I I don't understand why it has shifted to that momentum of away from the heart of nursing. Um, the nurses here in the room will understand. I hope my voice stays strong here. Um, that we all learned nursing through Florence Nightingale, at least
Yes.
our generation, and we
Hmm.
also are trying to teach that same nursing is an art through Florence Nightingale's
Yeah.
teachings and her ability to bring that kind of art and caring to this profession of ours. And we do see it leaving nursing. It
Mm.
is happening.
It
And my
is.
question for you is, do you think that there is a way? I'm all, Dr. Lucas, if you want to reach out to me, I'm in. Whatever you want to
Okay.
build,
Okay.
if you want to do more research, I'm in.
Okay.
But do you think that it is, what can we actually do with the generations that are following us? Because I also think it has the generations below us, the past the millennials into the Gen Zs, into the alphas, and
Hmm.
below that, they are being raised in a completely different environment
Yeah.
where they are um, praised almost for pushing back,
I know.
questioning authority. And I'm not saying it's not good. I think we should question authority. I think that is a good skill and strong um, tool to have because we can be abused by authority also at times in nursing. However, I'm sure Dr. Lucas and all the other nurses in the room, we would never, when we were in nursing school, we would never think to question our faculty. They told us what to do and we did it. We never questioned our doctors. We never questioned our mentors. We never questioned any of that. And maybe some of that was wrong, but I think the pendulum has swung a little more towards where we're almost being abused by our younger generation. I see that in my friends who are still nursing and they're in the upper level 50s and 60-year-old, and they've got these new kids coming in. And I'm not talking about 100% of this population, not
Right.
100% of this generation, but it is something that we have not seen before. Also, with this generation, if they are unhappy with a job, if they are
Yeah.
unhappy with a position, they will quit and they will move on. And
Mm.
nursing needs more dedication than that. We can't have the in and outs in nursing. It's not that kind of profession. You have to build the strength and the skill and the knowledge over time. And so when we're having new nurses, new generations coming in and out and in and out, and like you said, 60% leave within a year or whatever it was, that doesn't help our profession become this strong, resilient, kind, caring, uh, leader towards the healthcare genre that we have seen in the past. Like I said,
Yes.
I could talk forever, but my voice is now leaving me because I have a lot to say. So
Well,
anyway, if you could just speak to the
sure.
generational gap
Yeah.
that I kind of mentioned.
I thank you for that thoughtful response and question. You know, it's really big and pervasive, and it can feel overwhelming. And I felt that overwhelmed until the last few weeks when I realized what I have to do is write the class. In the end, it is it is how we treat people. I can only control my reactions and my actions. And so I've made it my ambition as an educator to make sure that I treat my colleagues and students with respect. And it doesn't mean that I don't say hard things. I have to tell them the truth. But in the end, we have to control what we do. And one of the ways that I've chosen to do that, and this is controversial, what I'm going to say, and so just please know that I've decided to remove myself from any political dialogue. I I think that the political environment is what's driving this. You're either red or blue, and you can't communicate with each other. And so that was one thing I had to do for my sanity is remove myself from political dialogue because it always ended in an argument. And it doesn't mean that I don't care about the issues. I still do. I still vote, all those things. But I don't want that to be the first thing you know about me is my political views. And so I try to bring that into academia because it is that topic comes up all the time, especially in healthcare. That's one thing. Another thing that has to change is social media. I think it gives us a platform to just be vile. And that's the next thing I'm going to do. I'm not quite off social media yet, but so it has to start with us, right? If we're going to change, if we're going to influence, not change, if we're going to influence the next generation, we have to treat them with respect, and truth and love and all the things that developed us. And so be the mentor that you've always had, that you've had or you want to be. So that's my philosophical answer. Sorry, it's not very scientific, but I think it has to start with us. Thank you for that.
Hi, Dr. Lucas. I have a
Hey.
question.
Yeah, hi.
Thank you for bringing forward a really important and relevant topic, not only for academia and higher education institutions, but healthcare as well.
Yeah.
And my question for you, you brought forward a few recommendations for the learning environment, including behavior contracts, policy, the course itself. What would that look like in policy development in an actual healthcare setting? Do you have any
Right.
ideas on that?
Yeah. So it requires whatever policy we want to do. Like if we say no raised voices, let's just pick that out. No raised voices when we have communication. So that's written into policy somehow. But every leader has to be on board with that. It has to trickle down to the leadership. So, in organizational psychology, I believe that you have to pour into the people who are managing and leading other people. And so the policy has to happen, and it has to be a realistic policy. Maybe raising voices is not one, but that's just came to my mind. But the policy has to be real and translated at the bedside. So many times in policy development in healthcare, they're so abstract and they don't work at the bedside. I'm thinking about rounding in the ER. I remember when that first came out, we had to sign a document every time we went into a patient's room in the ER. It didn't work. And so I think there has to be a realism from policy development to the bedside and then training everybody in the meanwhile. So I also, oh man, I'm going to say it. I also believe that mission and value statements need to be real as well. I do think people want to pull the cart the same way, but I think we need to get rid of hokey vision and value statements and to make them more realistic. So anyway, I hope I answered your question.
No, that was great. Thank you.
Sure. Anybody else?
There was somebody who had their hand raised.
Okay.
It was me. Sorry. I'm in clinic today, so I'm kind of in and out. But I just really, I kind of caught the tail end of it, and I just really wanted to say thank you. I really appreciated your presentation. I just kind of wanted to tag on what Dr. Olin was saying, about the whole generational thing. I think generational is definitely a component of it, but I also think there has just been a huge shift in the country as far as social and cultural types of norms, because I'm in the millennial generation, and I was when I was a baby nurse, I was raised as yeah, you do not question authority, you do what you're told, and all of that, just as she was explaining. And there are still people, my peers and that, kind of participate, like the students that we see kind of more recently that are questioning every single thing and, kind of how you were explaining. So I think that it's, generational maybe a component, but also I think things have changed. And I think maybe social media is a huge part of that, like you mentioned. And so I just kind of want to add that to the dialogue too. It's very interesting, and it's like things change all the time and we're just kind of rolling with it. So yeah,
That's
but we just really also wanted to say thank you for your great presentation.
Yeah. Jessica, I can't believe you're visiting and you're working and you took time to talk to me. I really appreciate that.
I've really enjoyed all these colloquial
Yeah, me too.
presentations.
I've had
Thanks.
it, I've
I'm
learned so
trying to be
much.
in. Yeah.
I hope I'm not going over time, but I did want to say one more thing about pathways in nursing. Um, there's many ways to get to be a registered nurse. You can do an ADN, which is an associate's degree. You can do bachelor's. They used to have this pathway called diploma nursing. And I feel like it is the key to bringing us back to our heart. Not that maybe it's the same premise, maybe the pathway doesn't work anymore. But my friends in Austin used to go to the hospital for their school, and they worked right beside the nuns in Ascension. And they learned their heart by the people that they worked with. And so at the end of their clinical time, they were an RN. And so I think modeling needs to come back. And I think Dr. Moore, my mentor, her theory for her dissertation was on Kolb's theory that we learn best by, you know, it being modeled for us and repeating in the whole cycle. So I think diploma nursing, the premise at least needs to come back. I'm curious if any other nurses think that or if you agree or any thoughts?
Hi, Dr. Lucas. This is Dr. Hanish. I actually started as a diploma nurse, and
Oh,
1 year into
wow.
my program, the local university said, no, we're going to have you get your bachelor's degree. So it was kind of interesting. And we actually ate, slept, and drank and did everything at the hospital our first couple years. So it's like residency, and there are some residency programs now which are really helpful. But I
Good.
don't know if we need to go back to that. To me, I think it's almost more an issue of how our healthcare system has changed to illness care rather than wellness care.
I
So you talk about
know.
politics. I think it's all the special interest groups that have really changed our environment that we're
I
working in.
know.
I don't think it's necessarily, yes, some of it's generational. My daughter is a nurse, and we sort of laugh about her generation versus my generation. And she said, but mom, sometimes I do question things because I have questions about them, not to be disrespectful. So we've had that conversation
Yeah.
many times in many bottles of wine, but that's another story. So I just wish that there was some way of us getting back to wellness care, because I think that's really the piece that's missing. It's maybe not even the politics, but it's the politics of the healthcare system now. And I think to me, that's one of the biggest influences. But regardless of that, I just want to tell you I appreciate your work and thank you so much. And there are a couple of suggestions in the chat. I hope you don't miss them about looking at educate. There's lots of educational nursing journals that you really should explore that I'm sure will not only will you get published, but you will find like-minded individuals that will jump on board with you and help you with your future. So thank you.
Well, that's very kind of you all. And so I'll show them my quilt and, let them look at it and feel exposed. But I'm going to look at the chat. In the recording, do y'all know, does the chat stay? Like, will I have access to the chat after I'm done? Do we know? 'Cause I don't want to miss any comments.
I'm not sure, but we can get that to you.
Okay, great. I really appreciate it. I don't want to miss any comments. So anyway.
So are there any additional questions? Dr. Lutz, I feel like we could all talk about this for the longest time. I'm just going to throw something out there, but this exact same scenario is happening in education. Teachers are the same thing. So I'm like, oh gosh, I feel like we could just talk about this all day long.
Yeah.
Because I mean, I'm seeing it in the education field with teachers, same exact scenario, honestly.
Well, we have to do something.
Yeah.
And you know what, today, so we won't feel like it's an effort and futility, we can just be that. Let's just be that for each other. Let's just be, let's be kind. We can do it. And we can still tell the truth, still get things done, and be kind.
Yeah. Well, thank you so much. If anyone doesn't have any additional questions or comments, we'll conclude, but this was wonderful.
Thank you so much. What a privilege.
Thank you.
Yeah.
All right. Have a great day, everyone.
Yes, thank you all for attending.
Thank you,
Thank you.
Dr. Lucas.
Thank you so much.
Yeah.